Every now and then.
Periodically.
Yeah.
So, in the hard copy of New York Times. She's the author of this book, When the Time Comes, Families with Aging Parents Share Their Struggles and Solutions. And I'm passing around a copy to take a look at it. If anyone's interested in purchasing this book, if you give us your name and how to contact you, we'll order for you and maybe at cost to the publisher?
You can order it at a big reduction from the publisher or just through the bookstore.
Right. So we'll try for the publisher and get it for you, or through the bookstore. So just let us know if you want a copy of the book. And Paula's also an adjunct professor here at the School of Journalism.
It'd be nice to know how many people here are either already caring for an older relative or, well, how many are already caregivers? How would you define yourself that way? Yeah. And the rest are sort of getting ready, waiting for the phone call. If it rings before 8 in the morning, this is not good news. Yeah, I like the word renowned, but actually I got into this not because of my professional background. I don't have any initials after my name. Every year my graduating grad students are better educated than me. I got into it just as a reporter, and because I teach journalism, and looking for a book idea and realizing that after I passed around 50 or so, all these conversations that I had with people in this town where I've lived for 30 years, the supermarket, on the street, all these conversations that used to be about, so how's your kid doing? How's that third grade teacher? Like, how are you dealing with the college applications? It had shifted somehow, and it was all about our parents. How's your mom? Where's a good assisted living? I don't know what to do. He should stop driving already. It's just this generational shift that it just began to seem universal, and it seemed like there wasn't a lot of discussion of it, so I kind of took it up and did this book that we can pass around, and then from that started writing this blog on the New York Times website, which you can find by just Googling New Old Age, and it will come up, and I write it a few times a week, and some other people contribute too, because for all of us it seems like there is this looming public health and public policy issue of what are we going to do with the fact that we already have more old people than we have ever had proportionate to the rest of the population in this country and around the world, and we're about to have a whole lot more. And we really have not, as a society, figured out how we're going to work with this, how we're going to help people have a good quality of life as they pass 70, 80, 90. I meet people in their 90s all the time. There's nothing that we have in place now is really set up for this. And so it all comes back on us, really. It's the family. The family has always been the way that society cares for old people. And it still is. And I get very angry when I hear people denounce my entire baby boom generation as, well, they just stick people in nursing homes. They don't care for people the way we used to. It's just, first of all, it's malarkey. It's just not true. Most people, older people who have need for assistance, which is 2/3 of old people at one time or another, do not have any kind of paid care. They are not living in institutions. The nursing home population is going down. Nursing homes are closing, which is possibly a good thing. But it means that it's all on our shoulders. And few of us are prepared for that. We think we are because we saw our parents and our grandparents do it. It seems like the natural thing. They took care of you when you were young and dependent, and when they get older and dependent, we take care of them, and we do. But it is harder now in a lot of ways than it was for our parents and grandparents. It's not quite the same landscape. For one thing, people did not used to live this long. It's routine now through, and it's a good thing. It's not a problem, except that we don't know how to quite to take care of them. But that people live routinely into their 80s and 90s, this is a tribute to medical science. But it means that people who are caregivers who used to have grandma move in for a couple of years, who used to commute to the nursing home for 6 months or 8 months, you can be a caregiver for an older person for a very long time, 5 years, 10 years, 15 years. And it takes a big chunk of your time. Those happy years when we finally ship the kids off and we think, yay, 50, I don't have to worry about my health too much for 15 or 20 years. I get this little bonus. Wait a minute, here comes the phone call. And it can go on for a long time. That's one change. The other change is we are all working. And many of our mothers and grandmothers were at home. So you can't really have your parent move in a lot of cases. You're not there. You've got to keep a job. That makes it a very different ballgame. Also, because of medical science, we are sometimes asked to do things that family members never used to have to do. To clean wounds, do dialysis at home, manage feeding tubes. This is stuff that trained RNs used to do. Now, in some cases, families do it. It costs a lot of money. And because many of us delayed childbearing, you can have children at home and an older relative that you feel responsible for at the same time, especially if your kids are moving back because of the recession. So it's just a different world than it used to be. And yet I think we haven't adjusted our expectations, and we still think we should be like the Waltons. I don't know if you remember this 70s TV show, but my working hypothesis is, you're way too young, but we all watched too many episodes of the Waltons. This, for younger members, was a show in which 3 generations of a family lived on a mountaintop in the Depression in Virginia. There was, at the end of the show, you saw the lights go out in the old farmhouse. Good night, John Boy. Good night, Jim Bob. Good night, Mama. And good night, Grandpa. And good night, Grandma. Because they all live together, and this is what we think we should do. And if we're not the Waltons, we think we are bad children. When in fact, we are the backbone. I say we because I sort of qualify. My dad's 89. I just moved him into independent living near me. He doesn't really need much help from me. He's lucid and pretty healthy. But he's on my mind, and I'm there twice a week. And many people, of course, are there 24 hours a day, taking care of older people. So there is this invisible army of caregivers who don't have a lot of political clout. They don't get a lot of help from any level of government. They're the ones that are taking care of old people in this country, and sometimes they feel like they're about to crack under the strain. So I wanted to hear from you what any questions that I could answer just by virtue of not being the renowned expert, but just have working on this subject for 2 or 3 years. But before that, I thought I'd pass along a couple of things that might be possibly useful. I'm going to tell you about a couple of pieces of paper, a new profession that's grown up that you might not have heard about, what I think is the best-kept secret in elder care, and a couple of passwords that might help you later on. So the pieces of paper, first of all, they come under the general heading of Advance Directive. They are the power of attorney and a healthcare proxy. Yeah. Some people know. These are just legal documents that help you play a role in your elder's care if things should hit a kind of crisis situation. So healthcare proxy just means that the person designates someone, usually a family member, to make decisions for them if they are incapacitated. They have a stroke, they have a heart attack, they just break a hip. They're just not with it, just break a hip. That's pretty serious. But I'm just saying you don't have to be at death's door to find yourself not really able to deal with the whole range of decisions you have to make in a contemporary hospital when someone wheels you in from an ambulance. So healthcare proxy says, I designate my daughter, by name, my son, my niece, to make decisions for me in the case that I'm incapacitated. Then when the doctors say to you, do you want a DNR? Should we do the surgery? You have the power to make that decision. If you don't have it, if someone doesn't have it and show up, they'll do the full range of stuff, which might be what your relative wants or might not be. So this piece of paper, for which you do not actually need a lawyer, they are the National Hospice and Palliative Care Organization, which you can find on the web, and it's also in the back of my book. has the forms for every state, and they're different for every state. So you don't actually need a lawyer. If you could afford one, though, it's probably better just to be able to tailor the document to your particular family. And the other document besides healthcare proxy is power of attorney. In some states, these are the same piece of paper. In most, they're separate. Power of attorney just means allows you to do the other legal stuff, not the healthcare part so much, but the other legal stuff that someone might need if they're having, an illness, a crisis. If they're in rehab and you need to pay their rent, you can't sign their checks legally without a power of attorney. Or someone moves into assisted living, doesn't need the car anymore, can't really go through the process of selling the car, needs you to do that, but it's not your car. So you can't actually sell someone else's car unless you have power of attorney. This is also something that you can find on the net, although I think it's helpful if you can manage it to have a lawyer do it. It's not a big expense. For most people, this is a pretty straightforward thing. But the beauty of these documents, aside from what they let you do on behalf of an older person who might need your help, is it's a way to start the conversation. They're not really age-based. Really, all of us should have these documents, and I do too, because I could get hit by a bus tomorrow and need my daughter in Brooklyn to tell the doctors what to do. So it's not one of those things that, that it may be less one of those things that people avoid talking about because they don't want to think about getting older and they don't want to think about mortality. But this is something that is not age-related, that anyone can have. And it's a way of starting this conversation that we all need to do, that nobody wants to have, about what would you like to happen, Mom or Dad? Years before, if we're lucky, years before you even need this to happen, what would you want us to do if you were hurt, if you couldn't stay in this house with the steps and we needed to get you someplace that was all on one level? Where would you want to live? Who would you want to have take care of you? Let's talk about it before there's a crisis. When there's a crisis is a really tough time to make decisions. And it means that it's much more difficult to involve the person whose decision it is. So this is a way of actually giving them some autonomy and some power to make their own decisions. And these two pieces of paper, maybe you and they could go to the lawyer, especially if it's a trusted family lawyer, and do this all at the same time. Then everybody's doing it, not just the old people. Because this discussion of, are you really committed to staying in your apartment or your house? Is that what you really want, is to stay here? Are you one of those people that says, and you've probably already heard it, I am not leaving here except feet first? Well, yeah. It's, it's a good sentiment, but it's not a plan. So if you want to stay here until you die, then how can we make that happen? Maybe we need to have an occupational therapist come in, look at the house, and say, okay, if you want to stay, we have to put some grab bars here. We need a raised toilet seat. We got to get these scatter rugs off the floor. We need a raised bed. Things that will make it more elder-friendly to stay. On the other hand, like with my dad, when we had this discussion, he didn't want someone coming in to take care of him in his place. He thought it would be too lonely. He's a social guy. He didn't want to be alone with an aide all day if that should happen. He always wanted to go into some kind of congregate setting like assisted living. So, okay, now I know, what he wants me to do, and I'm not going to feel like I'm groping in the blind, in the darkness, if something happens, which so far, we've been okay. But starting the conversation is always hard. It's always hard. So these two documents are one way, I think, to get it going. And of course, I shouldn't call it the conversation. It's a series of conversations. Nobody figures this out in one sit down. But to make it sort of part of what you talk about, so that it's not some fraught thing. All of us are now going to sit down the Sunday after Thanksgiving and talk about aging and dying. Maybe this is a way to start it, because I hear all the time from people, they don't want to talk about it, they don't want to think about it, they're never going to move, they don't want anything I suggest, the answer is no. Maybe here's a way. Okay, you don't want to do that, then how about this? Because the reality is 2/3 of older adults will need some kind of assistance. Now that leaves, a third that will just, go along fine, but those are not odds I particularly want to take, and I don't want to feel like I'm guessing when the time comes. which is the title of my book, When the Time Comes. It's not if the time comes, because most of us it's when. So those are the two pieces of paper that I think all of us should be able to put in place. It's a way to get people talking and thinking about what's ahead, and it gives you some legal ability to handle things when stuff comes down. So it's one thing I wanted to pass along. The other thing is, I don't know if people are aware that there is this new profession that's sort of grown up in the last 20 years or so called a geriatric care manager, GCM. And geriatric care managers are usually social workers, sometimes nurses, who've done additional training, and now they're sort of like the general contractors for elder care. You know, in an area, this is very complex, and you know, in some countries it's actually pretty simple. There's, you know, a series of agencies and homes, and they kind of take care of the, but you know, that's not the way America works. There's the state, there's the city, there's programs, there's private foundations, there's all different kinds of ways to get help, there's all different kinds of ways to live. A lot of them cost a lot of money. It's very confusing for people when they start trying to navigate this, and lots of people have felt there should be some pro who can just do this. Well, there is. A geriatric care manager, I've seen some of them in action. I have one myself to help me with my dad. And these are the people that know in your particular area what the options are, and can, especially if you're long distance. I don't know, are any of you far from your parents or elder relatives? Really difficult if you've got someone who's 2 hours away, 5 hours away, across the country, and you can't be there. You sort of want local eyes and ears to call you up and say, I think she's not eating enough. I think she's, you know, needs more help in the morning. She's going and she needs to be in rehab, whatever. A GCM can help you do this. The downside is they're expensive. They cost like $150 an hour around here. But it's not like going to a therapist or something where you pay that every week. You pay them for the help that they give you, and you might not need them for very many hours. In some cases that I've seen, someone's moving a parent up, let's say from Florida, working person, has to figure out what's a good assisted living around me somewhere. Calls a geriatric care manager who knows all these places and says, you know, meets the parents, does an assessment, says, you know, I think the following 3 places would be good, let's go look at them. Or who knows what the good home care agencies are. Meets the parents, says, I think, you know, 4 hours a day would take care of it. The rest of the time they can be there on their own. Here's a couple of agencies I've worked with before. People like having someone work through them. Now, also there are some agencies that have geriatric care managers on a sliding scale. And the National Association of Professional Geriatric Care Managers has a locator on the website. It's in the back of my book also, where you can plug in your location and see who's around you and just call up and say, how much do you charge? What do you do? How does it work? These are not people that you're going to need forever, probably, but they're there to help with transitions. And then you might say, okay, we're fine for now. We'll call you in 6 months if something changes. If you call your local area agency on aging, which is the free equivalent, and some of them are very good, and you can find what your local agency is on the Elder Care Locator, which is a federally supported website that will tell you what's available in your area on all kinds of things. But the local, they call them AAAs, Area Agency on Aging, will also know what's available, but usually they give you a list, and you need to do the research. And that's what, you know, a lot of people will do, and it's a good resource to have. But if you're in a sort of, if you're in one of those situations, and if you've been in them, you know, like you could barely think or sleep, having someone to talk to who knows you, knows the parent, doesn't just give you a list, but says, here, let's do this. I think these are good people. I don't think we need that. That's really useful, and if you can afford it, I think it's something that people are happy to know about if they can take advantage of it. The other thing, I think the best kept secret is adult day programs. Do people know what they are? There's one right over here, actually, Amsterdam House on 115th, 12th. Most people will tell you, most older people will tell you, I want to stay in my home. And, you know, who wants to move when you're 85? And the place that they least want to move is a nursing home, right? Assisted living they think is marginally better, but also expensive. But what most people want to do is stay home, and that sometimes that is possible, with a little adjustment of the place, a little, some help coming in, that's possible. But the downside is people can be alone all day because it's hard for them to get out. Maybe they can't drive, or they shouldn't drive, or maybe they just don't have the stamina to, go out and do shopping and so forth. And so people can be isolated and a little lonely, and that can lead to depression, and depression leads to health problems. And how do people have some kind of social interaction and still live in their homes, especially if they're alone? Adult day programs, people sometimes call them adult daycare, and other people think that's a little insulting, but it is the same idea. A van comes, picks you up in the morning, takes you to a senior center or some location where there are other seniors, there are activities, there's exercise, there's art classes, there's discussions, there's music, there's hot meals, there's usually a nurse on premises to administer medications and do blood sugar checks and stuff like that. Some actually are fairly elaborate, and they can do bathing and hairdressing. They can be private, they can be public. There's a whole range, if cost is a problem, of Medicaid and other state and local grants that can help defray the cost. People can go for 1 or 2 days a week. People can go every day. Many of them can take people with dementia, so that staying in your house does not equate to hours and hours alone all day, every day, especially if family is not nearby or just can't be there a lot. So adult day, I think people just don't know about, and I've been in some of these programs, and they can be really very well run, and most people want to have some friendships. And so the idea that you can have that and not have to move is very appealing to families. And the healthcare aspect is also important. Someone is checking on your parents' health a lot of the time without you having to drive them to a doctor's office, which is what caregivers already spend a lot of time doing. Right. Well, I mean, the good thing about New York is that there is a lot of this stuff around. And as a state, we've been pretty progressive on doing senior centers and adult day programs. And but it still can be sort of bewildering where to go. But adult day, I think, is it's underused. There have been a lot of budget cuts lately, as with any public program, but there still are a number of them around. And you can see people blossom there. The other thing I want to talk about is you as a caregiver, because if you're not really in the hip deep in it yet, you're probably coping just fine and staying employed, and you may have a family of your own, but as it gets more intense, if it gets more intense, caregivers suffer too. There's been actually a lot of data on this, because we do recognize that individual family caregivers are still the backbone of the system, and without them, system is probably even too nice a word. This sort of patchworked way we try to take care of our old people, and the center of it always is the family, which I think is what most people would actually prefer. We do think it's our job, and people want to do it as well as they can do it, but it can take a toll on you. It can take a toll on your own health, your ability to sleep, your ability to, people do get depressed. They actually have, depressed immune responses, especially if you're on the clock all the time, or if a family member is living with you. It's really hard on a caregiver. And probably what we really need is things like tax breaks, more money, stuff like that. I don't think we're getting those anytime soon. But at the least, find some kind of support for yourself, and there are lots of support groups. Probably the program that you mentioned can help you find them. They're all over the web. I've had people say, why don't you go and take notes? I can't leave, but you can do it by phone. You can do it online. Find some safe place where, as things get more intense, there are other people that are where you are, and that, where you can say the stuff you really don't want to say in public, like here. Like, I don't think I can stand this. Like, this was always a lousy father. I can't believe that I'm spending all this time taking care of him. Like, wasn't he supposed to have died already? If you think you're the only person who ever thinks this, let me tell you, A, you are wrong, and B, it is just helpful to know that as you deal with this stressful situation, that other people are in the same boat, and the research shows it does help, even though it sounds at the beginning like, oh God, one more thing I have to do. But support for caregivers, hugely important. And it's funny that people don't necessarily identify themselves as caregivers because we think that, that's the Waltons. But if you are going to the drugstore, talking to the doctor, dealing with the Medicare forms, if you're, just stopping by twice a week to make sure there's food in the refrigerator, driving to doctor's appointments, if you're doing that, you are a caregiver. And you've taken on a part-time job that sometimes becomes a full-time job on top of the job that you already have. So this idea that, we should just do it, just suck it up, I think that's tough. And find people that can help you. And the other thing, before we just kind of chat, is there are a couple of passwords. Every profession has these, and certainly the medical profession has these. There's a couple of passwords that open up whole channels of conversation that if you never say the word, you might never have the conversation. And I'm looking ahead now, some years. We don't know how many years. I have a healthy 89-year-old father. When do I have to have these conversations? Next year? 5 years from now? I don't know, but at least I know the magic words. Because one day, most of us will be sitting in some hospital conference room or in the lobby or in some doctor's office trying to figure out how much treatment a frail older person with multiple health problems should have. At what point do we say, I don't think we want to do this anymore? There's a lot of research on how overtreated old people are. Now, at the same time, there are a lot of people that are undertreated, and it has to do with where you live. If you're rural, it has to do with things like income, race, ethnicity. Lots of things come into this. But there are also, partly because it's all paid for by Medicare, there are also examples of older people getting unnecessary tests, getting surgery that's not advised, and this particularly becomes true when people are at the end of life, and if we all knew when that was, things are simpler. But there often does come a time when you start to think to yourself, what are we putting him through this for? How many more months is he really going to have? Are they going to be good months when he can talk to us and feel surrounded by family and have some peace, or is he going to be in an ICU, with machines beeping and tubes coming out of everywhere? And how do we know? So to me, and we turn to our doctors for this. They are really not very good at this. It's not what they're trained to do. They're trained to save lives. But there are ways of having this conversation. And sometimes they tell me, these physicians, because it's easy to blame them, oh, you just want to make all this money on Medicare, you'll never stop treating. There's that joke about why are there nails in a coffin? And the answer is to keep the oncologist from administering more chemotherapy. Yeah, I know. People who work in palliative care and hospice care have very dark senses of humor. I did not make this up. But if you feel like, I think we might be coming to that point, and especially if your parent is one of those, like my dad, who says, don't do this to me. Turn off the machines. Immortality is never on the menu. Not yet. So the words are palliative care and hospice. And they are both misunderstood, so I wanted just to talk a little bit about them. When you say to a physician, do you have a palliative care unit at this hospital? Is he a candidate for palliative care? What about palliative care? Palliative care, it doesn't mean that you're stopping treating this person. That never happens. It just means that you are changing the focus from trying to make him better, well, to trying to keep him comfortable and give him quality of life, or her. Usually it's her. Because the things that make sense for a person in their 60s or 70s can sometimes stop making sense if we're talking late 80s, 90s. People have multiple health problems. They may have dementia. The idea of, and yet there There are elderly people, elderly women every day who get with dementia, severe dementia, can't speak, can't eat, getting mammograms. Why? And people having all kinds of procedures done. If you don't have the conversation, they will push on the chest and crack the ribs, which is painful. If you don't have the conversation, and you keep waiting for the doctor to say it, they're waiting for you to say it. So palliative care just means we want to take care of him, we want him to be comfortable, we want him not to be in pain. But we are not going to do the things that you would do to someone who was 20 years younger because his body can't take it. It will not make him better. It will not prolong his life, but it might prolong his death. Palliative care is one word, and the other is hospice, which is not a place that people go to. It's a service that comes to you, and they are the specialists in end-of-life care. Just as we have specialists for every other thing, many older people, one of the things that's different is they don't just have a doctor. They've got 5 doctors. They've got the cardiologist, they've got the neurologist, they've got every kind of ologist. Well, hospice is the specialists in end-of-life care. They have a very good record at reducing pain, reducing anxiety. They will send people to your home or your parents' home, social workers, nurses, household aides that'll come and just help with the cooking, the laundry, the whatever. And many people who have a terminal diagnosis, but who in fact may not die for months or a year or more, can be cared for under hospice care, and families just talk about the people who do it. The word you hear all the time is angels. I don't personally particularly know if there are angels, but I have seen these hospice people, and we had hospice care when my mother died, and it makes all the difference. You don't have to go through this yourselves. But you could go a long time before you hear a doctor say, I think she might be a candidate for hospice care. Actually, what the research shows is some practices bring it up all the time, other people never mention it. So I'm just passing it along to you. And the answer sometimes is no, but that doesn't necessarily. If the answer is no, I would look for another opinion too, because I think there's almost no downside to having hospice care. If your parent recovers and does well, then you just go off it, and you can go on it later again. It is paid for by Medicare, and it's a enormous consolation and comfort to families and a lifesaver that now 40% of people in this country who die in hospice care, which is a good thing in my mind. But the bad part is they enter hospice care when they have days, just days to live, because everybody waits thinking, we're not going to give up. Things are going to be better. We're not going to call hospice yet. Call them. Please just do this for yourselves and for your families. It makes a huge difference. And if it's not time yet, then you have not done nothing that's irreversible. You can always say, okay, he's better. Never mind. We'll call you in 6 months. We'll call you in a year and a half, and go back on whatever health care you had before. Nothing has to change, but it's useful to know about. And of course, it's the thing that we don't want to even think about. But this role introduces us to those subjects that we can push off for a long time. It introduces us to the fact that life is not finite, and that the American healthcare system has somehow contrived to make the end of it hugely fraught, expensive, and non-comforting. And there is another way. You don't need to involve any kind of particular ritual to do it. You just have to say hospice and look for a nonprofit. In all elder care situations, if you have an option, I would look at the nonprofit institution first, the nonprofit adult day program, the nonprofit hospice, the nonprofit assisted living. Not that this is a fail-safe way to make choices, because there are bad nonprofits and good for-profits, but in general, where are the for-profits making their profits? Right? Either they have to provide fewer services, or they have to charge more money, and they don't benefit from philanthropy. So no one's going to hold a bake sale for some huge national assisted living chain, whereas nonprofits, people often do chip in whose families have been there. So that's my little spiel, and I'm just interested in hearing about your own situations and what, and I think, we all learn from each other where you are with your own caregiving, or whether you're one of those really extraordinary and rare people who's planning in advance. Good for you. Good for you. Because having, I know, you're going to India with your mother. So this is not a person who's going to need, any time real soon to be in assisted living, clearly. But to be thinking ahead, I personally find it comforting to know that I was that lucky person whose father would talk about this stuff. And so, years before we needed it, I knew, he didn't want to be alone in his apartment with an aide. He wanted to be in assisted living. We actually went around together and looked at a couple of places that we thought might work. And then in the end, I chose a place that was near to me because he was 125 miles away. And, but we talked about it. So I feel lucky on that score. But it was a comfort to me all those years that whatever happens, bad stuff's going to happen. But at least we're not going to be sitting around either thinking, what would he want? Or worse, siblings fighting with each other, because that happens. He would want that. No, he wouldn't. You can't give up. You just, no, that's, what's worse than that? When is there a time when you more need to pull together, if you're lucky enough to have siblings that are involved, than when there's some sort of crisis with your parent? So, anyone want to offer some wisdom or ask a question or tell me where you are?
You did mention, actually both my parents are still very much alive and thankfully, healthy. And,
yeah.
My father's 81,
mm-hmm.
and my mom turned 79 today.
Wow. We should sing.
And you know what? I've been so distracted I almost forgot. And I saw my parents are my neighbors. They live below me. I was saying I chose years ago to live close to them so I wouldn't have to necessarily live with them. But I'm trying to set things up in a way that, because it is just me.
Mm-hmm.
I had a brother who just passed away 3 months ago at 57.
Oh.
So it really is just me. But, I'm trying I go to therapy. I decided to go into therapy because I said, I know that this is all going to happen, and I want to be as prepared as I can. I know, you probably...
So smart.
Can never really be prepared for it, but... my mother always said as a kid, in Spanish, la ley de averaje says, the law of averages says, she's going to die soon, and, or even though her mother lived till she was 97. And my father's mother lived till she was 93. So I'm hopeful, but, it's just scary.
It is scary.
It's just really, really scary. And, my father, the thing with my dad is the driving.
This is like #1 question on this blog is how do you,
I literally call my if I know my dad, my parents, they also live in Puerto Rico for the winter. Lucky them. But, driving anywhere is dangerous. In Puerto Rico, it's just, suicidal almost. What I do is I call my parents before the sun is going down to make sure they're home. And then if dad isn't home, I yell at him. But, but it's like,
right.
He gets mad because I'm trying to limit, but he can't see at night.
Yeah.
So what do you do?
It's, and driving, if you're a native New Yorker, you might not actually quite get this. But in the rest of the world, even New Jersey or Long Island, driving is independence. And if you give it up, you are, acknowledging your dependence on the emotional side. On the practical side, there's big chunks of places where you really can't get around without a car. There's no, you could wait a really long time at a bus stop, which is not what you want to be doing when you're 84 and it's cold or it's hot. So it is difficult. And sometimes, my own dad, bless him, had a fender bender, nobody was hurt, said to me, didn't sleep all night, said to me, what if I had hit somebody? I think I should stop. I said, yes, that sounds like a good idea. And we'll call the paratransit. Every county in America has a paratransit system that provides transportation for people who are disabled and people who are old, and it's very low cost. And the local area agency on aging will know how to apply for it. So on the one hand, it doesn't mean that if you stop driving, you can never leave your house again. On the other hand, it does take away some of your spontaneity. You have to call the day before and say, I need a van, or sometimes it's a cab, at 10 in the morning to take me to X, and then I'll call you to come pick me up. So it will take you there. It's not expensive. You know, if you're used to just getting in the car and going where you want to go, whenever you want to go, you won't like it that much. Sometimes it helps to say, you know, it's one thing, you've had your full life. It's one thing if you have an accident and, you know, maim yourself. It's another thing if you hit somebody else, a kid, somebody on a bicycle. Do you want that on your conscience? I don't think I want it on mine. Sometimes that does it. Sometimes people have been known to, especially when people have dementia, and I should have mentioned this, you know, that it's one of the ways in which our work is different than previous generations, because Alzheimer's is the most common form, but there are many other forms, and it increases with age. It's, you know, partly it's your genetics, but also it's just age. You know, once people hit 85, almost half of people over 85 have some degree of dementia, and it gets worse. So that means you can't make good decisions whether you're in a car or not, but when you're in a car, you're a lot more dangerous. So there have been families where people just take the keys, you know, take the car. Where's the car? It's in the shop. Oh, okay. Or take the distributor cap. You know, sometimes people can be driven. It depends on how bad their driving is. You know? People can be driven to desperation here. Now, some states have begun to require retesting at certain ages, or they require that you come into the motor vehicles department and renew your license. Just show up. And that in itself will cut out some number of people who just got used to mailing it in every. So it is, you know, states and the Federal Highway Administration are aware of this problem, but as with most things, it's kind of on us. Yeah.
I have a question about the healthcare proxy. So you complete a healthcare proxy, and you're not, or older adults, you know, complete one, and the person who's the proxied person isn't around all the time. Should that, and how can that be accessible? It doesn't really do any good being in my apartment, being in a lawyer's office, is there, I mean, even if...
You mean the actual document?
The actual doctor. So even if you give them to your doctor?
Yeah, I would.
And then, but if there's an emergency room visit, how is that, you know?
Yeah, it's imperfect. I mean, they tell you to put it on your refrigerator, you know. Like the EMTs will look on the refrigerator to see if there's one there. I have, you know, my kid has one. It's on my refrigerator. I've got my dad's. My sister has it too. I'm the proxy, but she's got it in case I'm somewhere else. The geriatric care manager has it. Does that mean that I'm 100% sure that they will know who to call? You know, it's an imperfect system, partly because it's so fragmented. But basically, you want as many people to have it as possible, and you want it in as many locations as possible, just because they will. The first thing they will say is, "Do you have a DNR or not?"
But if they ask the person who can't really answer that question, that doesn't really get you anywhere.
Recently, a friend of the family from, you know, since I was born, he disappeared, and his wife couldn't find him, and he was on his way to a doctor's appointment, and he was missing.
Wow.
For 3 days.
Wow.
And ended up dying, and no one knew. He didn't have. He had his medical card, but his medical card didn't have the address or the phone number of the next of kin.
Did he have dementia?
No.
Well, where did he go?
He had a stroke. He had a stroke on his way to the doctor, and so there was no way to speak to him. And you know what? And that also, like, kind of, you know, and his wife didn't find out until finally the police came, and that was only after 48 hours and that whole thing. Yeah. But I'm just saying that to say, I mean, I learned something from it, and You know, I actually put a card in my parents' wallet with all my information, and on the other side, their medication.
Yeah.
Our medication.
That's a good idea. If, you know,
Scary.
yeah, it's unusual. Like, where can you go and have a stroke and no one around you notices or calls a cop or something?
Well, no. He was in the hospital.
Oh, and they didn't know.
And they didn't know who to call. He was in the hospital for a test. You know, so this wasn't even really his hospital. So they didn't have a lot of things on file. This is what, you know, I was told. So even though so then what they did was they did all these, they resuscitated him. They did all these brain surgery, all the stuff without his next of kin knowing.
Wow.
Yeah, but because it's like...
He had his Medicare card.
He had his Medicare card.
It's paid for. Yeah, you know, it's unusual, but more commonly when that happens, you know, people wander when they have dementia. And so there's all these technological things like little bracelets, little pendants. I wrote last year about some company that's put a GPS in shoes because people with dementia will take off the bracelet or something, but like, you know, they might take off their shoes too. And you can program it so they can wander within a certain area, like the yard or the block. But then if they go past that, it alerts you or it alerts someone else. There's going to be a lot of role for technology here, though it, alas, is not going to replace us. There's no programmable elder care robot yet, nor do I think we necessarily want that. But yeah, I mean, let me just say, this is a scary story, and there are lots of scary stories, but there also, I think, has to be a sort of reality about what we can do. You know, we are not superhuman. We can't be everywhere all the time. We can't prevent all disasters from happening. We manage them the best we can, as lovingly and caringly as we can. We can't cure some of these things. There is no cure for dementia. There's no proven way of staving it off except exercise. You know, we can nag people about what they eat, what they smoke, what they drink. They might listen, they might not. Sometimes you can have some impact by bringing in allies, like, you know, who are you? You're just my kid. But your doctor or your lawyer or, you know, someone else that, you know, has more authority says, don't do this. Maybe that helps. Maybe it doesn't, you know. People's personalities and habits do not magically change when they get older. If anything, they probably get more intransigent. And, you know, my vision of caregivers is this sort of unacknowledged army of people, mostly women, who are just slogging it out, everybody doing the best they can with not a lot of help, hoping like hell that they're doing the right thing. And really, people should be standing up in Congress and applauding you and saying, thank you, you know, for the hundreds of thousands of dollars you have saved the American taxpayer by keeping your family member out of a nursing home, which Medicaid would pay for. Thank you for taking care of these people for whom we really don't, you know, Social Security, how much is that? Medicare? Okay, good, works reasonably well. Besides that, you're kind of on your own. People should be holding, you know, parades in your honor downtown, and they're not. But let me just say that...
Still go Giants. But still go Giants.
Yeah, no, that's fine. They can have theirs today, and, you know, you could have yours tomorrow. It's not going to happen, but I think, you know, one thing that we can do for ourselves is to recognize our limitations. We're all just trying to do the best we can for the people that did the best they could for us. And, you know, they weren't perfect. We're not perfect. But we do have a lot of people in the same boat that have been through it, that can hear what you're saying without judgment, that can offer you some of their own advice and things that help them. It's very different for every family. It's very different for every old person. There's not, you know, there's no one-size-fits-all solution. But there are just a lot of people giving a lot of their time and energy, and it's, you know, it restores your faith in human nature, actually, what people do. Anybody else want to chime in? I know everybody's got to get back to work. I appreciate your coming. If you want to order the book, the Carol's office will do that for you. And The blog is called The New Old Age, and everybody there, there's a very lively comments section, and everybody there has a story to tell. And I started doing it. I inherited it from someone else 2.5 years ago, thinking, wonder how long I can keep finding stuff to write about, and it has not been a problem. So, thanks so much, you guys.